front and palm together, also interlocking fingers. And I'm looking at the thumbs. I want to wash them from the bottom to the top until I'm going to stop. Then I'm going to lock my fingers together and stand like this, rubbing my knuckles against my palms because germs are after the knuckles. Yes, on both hands. And then I'm going to make the fingers together, rub the tips against the palm of my hand like I want to gesture that I'm angry. Now, open the deck. Go step. If I were alone, paper towel. I would first dry my hands. And then take the second paper towel to close the deck. It is crucial to remember when hands are contaminated with body fluid to wash with soap and water. Otherwise, alcohol and sanitizer will be sufficient. And to dry with alcohol and sanitizer, keep hands still because germs love the air.
Splish splash, I was taking a bath, long about a Saturday night. Yeah, rubbed up, just relaxing in the tub, thinking everything was alright. Well, I stepped out the tub, I put my feet on the floor, I wrapped the towel around me and I opened the door, and then a splish splash, I jumped back in the bath. Well, how was I to know there was a party going on? There was a splishing and a splash, reeling with the feeling, moving and a grooving, rocking and a rolling. Yeah, yeah.
Good morning, sir.
Oh, hello.
How are you today?
I'm good, thanks. I'm just
You
lost.
look very lost. Okay, you can come with me. You are a patient today.
Yes.
Okay, so you can follow me. Yes, sir. Thank you. And then take a seat on the bed. The student doctor, Shannon Simpson. Nice to meet you, sir. Before we get started, I just need to ask you a few questions about abnormalities. You don't have any nausea, vomiting, dysphagia, that's struggling to swallow?
No.
No constipation?
No.
No pain?
No pain again.
No pain, no gain, sir. I'm just going to need you to lie flat down,
Yes, ma'am.
a pillow under your head and your arms along your sides. Okay, but I would expose your chest now, but my colleague is going to come in and do that for you. You don't have a full bladder?
No.
No need to go to the toilet. Okay, I'm just going to feel for your temperature. Feels fine. And then your pulse as well, radial pulse. Okay, it's a nice steady beat, sir, so I don't find anything wrong with that. Right now, you are ready to be examined. Okay, so my colleagues will come in and then I'm going to leave you for now. Okay. Before I leave, I just need to check for good lighting. And everything seems fine in here. Thank you. Hi, sir.
Good evening, Mr. Van der Merwe. I'm Xavier. I'm a medical student. Do I have your consent to examine you and ask you a few questions today?
Please.
Okay. Have you noticed any appetite changes or any severe weight loss recently? Nothing. Okay. I also don't see any muscle wasting, so no visible signs of food malabsorption. Can I please examine your hand?
Yes.
Okay. There's no hyperpigmentation, no blue discoloration at the fingertips, and no peripheral cyanosis. There's also no yellow discoloration, which would indicate jaundice. Your nails aren't pale, they're also not spoon-shaped, which is a condition known as koilonychia, which presents in anemia. They're also not white, which is a condition known as leukonychia, which would indicate chronic liver disease. Okay, looking at your palms, if they were red, it would indicate palmar erythema, but you don't have that. Then looking at your palmar creases, if they were pale, it would indicate anemia due to a gastrointestinal pathology, but you also don't have that. Okay, avoidance contraction is also not visible. Now we're going to test for clubbing. I'm going to ask you to please do this for me.
Okay.
Okay. Now in a patient that doesn't have clubbing, we're looking for that nice diamond shape over there.
Yes.
And to diagnose clubbing, it needs to be present in all 10 digits. So just please do that. So clubbing is indicative of cardiovascular, respiratory, as well as gastrointestinal pathology such as inflammatory bowel disease and chronic liver disease. Okay, now we're going to move up to your face and just ask you to sit up for me. Okay. I'm going to pull down your eyelids slightly. This is to inspect your palpal conjunctiva. Because they're nice and pink, it means that you're not anemic. That would be the case if you had pale conjunctiva. Your sclera also white, they're not yellow discoloration, so no jaundice. Can I ask you to please close your eyes? There's no fatty deposits, so no xanthelasma is present. Please open your mouth and stick out your tongue. Okay, your tips and the sides of the tongue aren't blue, so no central cyanosis there. Then we're going to examine for edema. So I'm going to ask you to lie flat on your back. Can I please roll down of your hands.
Please.
So I'm just going to apply slight pressure. So because the skin refills immediately, there's no sign of pit edema.
Okay.
Hi Brendan, I'm
Hello,
Shauna.
Shauna.
Can I please ask you to sit up with me because I'm going to be performing an abdominoplasty on you, and this is just a check of any enlargement of the lymph nodes. So I'm going to start here: preauricular, postauricular, occipital, tonsillar, then submandibular, submental, and then anterior cervical chain, the posterior cervical chain. Please ask you to look to the left for me. Deep cervical chain on the other side. Deep cervical chain, and then supraclavicular, and last supraclavicular. You don't seem to have any enlargement of the lymph nodes.
Fantastic.
Sani Bonani, Mr. Van der Merwe. My name is Okara, and I'm going to show my student Anton here the 9 different regions of the abdomen before he performs his general exam, if that's okay. May I please request that you take your shirt off?
Yes.
Thank you. So Anton, we can divide the human abdomen into 9 different regions, and we divide these regions with the help of different planes. So we get our 2 vertical planes by determining the midclavicular lines, and we get the midclavicular lines by looking at the middle of the sternal head and the anterior clavicular head, finding the midpoint and extending the line down the region of the abdomen. So we get those 2 vertical planes like that. We also get our 2 horizontal planes called the transtubercular plane at the bottom, and we get the transtubercular plane by looking at the top of his iliac spines on either side and connecting those with the line. And we also get on the top what's called the transpyloric plane. And the transpyloric plane coincides with the pylorus of the stomach, and that's how it gets its name. So the different regions of the abdomen, if we start on the right side of the patient, is the hypochondriac region at the top, the lumbar region in the middle, and the inguinal or iliac region at the bottom. And that's exactly the same on the left side of the patient, except we call them the left sides. And then the middle regions of the patient from the top are called the epigastrium, in the middle is the umbilicus, and then at the bottom is the hypogastrium. So those are the different 9 regions of the abdomen. We can also divide the abdomen into different quadrants. So we get that by drawing a line down the middle of the abdomen, and then also a line horizontally across the abdomen. And these we just call our right upper quadrant, our right lower quadrant, our left upper quadrant, and our left lower quadrant. So those are the different quadrants of the abdomen. Another point that I'd like to show you before you start your exam is what we call McBurney's point. And McBurney's point is the site where we find the appendix. So to find McBurney's point, we locate the umbilicus, and we also identify the right anterior superior iliac spine. We draw a line between these 2 points, and we divide this line into thirds. Where the top 2 thirds meet the bottom third is what we call McBurney's point, and this is where we find the appendix in most people. This is also the site of rebound tenderness. So if I push in on this point, there should be no pain, but when I release my hand, there is tenderness, and that's what we call rebound tenderness in McBurney's site.
Goedemorgen meneer.
Order.
Is it fine if I perform the general examination on you?
Please.
Okay, so first of all we're just going to take a look at the skin. There's no clear discoloration of the skin. The body hair distribution looks fine for a male. There's no clear signs of rashes or striae on your body. And now we're just going to take a look if you can see any scars or lesions that might indicate any previous operations, which there are none. I'm going to take a look at the shape of the umbilicals. It's not inverted or protruding. It's not red, which would indicate any signs of inflammation, but none of that is true. I'm going to take a look at the shape of your abdomen. It's flat, it's not round or distended, which is good. I'm going to take a look at the symmetry of your abdomen. There's no clear masses or any clear enlarged organs, which is what we want. And now I'm just going to make sure I didn't miss any hernias. I'm going to look at the inguinal area. I'm going to ask you to cough for me quickly. As we can see, there was no clear indication of hernias, which is good. Now I'm just going to take a closer look at the epigastric aortic root. Just going to see if I can see any clear pulsations. I can't see anything. Also just going to take a look at the intestine. What I'm looking for here is to see any clear peristaltic movements, which I can't see, but this might be visible in very thin patients. Oh, that concludes the general examination. Thank you.
Goedemiddag Brendan.
Hello.
It's me again, Shauna. Bahini and I are just going to be looking for any signs of dissection in the abdomen. So I don't see any veins or anything present on your abdomen, but there are 9 reasons why your abdomen could possibly be distended. So they include fluid, fat, fetus, fat in pregnancy, flatus, feces, filthy tumors, fibroids, and lastly, if you have a full bladder. And Bahini is going to explain the clinical appearance of this.
Hello, Greyling.
Hello.
So the clinical appearance of a distended abdomen would be that your flanks
which would mean you have ascites. So there's two methods to test for ascites. First one is known as fluid throw, and Nolini is just going to help me here by placing my hand vertically over the like this. I'm going to place my hand on either side of your abdomen, and I'm just going to flick your abdomen gently, and there's no presence of a waveline movement on the other side, so that means that there's no fluid.
Cool.
So as you saw, the technique to look for fluid in the abdomen is known as fluid throw. If we did find any fluid in the abdomen, we would then use a technique called shifting pelvis to see the extent of the accumulation of the fluid in the abdomen.
Hello.
My name is Bianca Wells.
Welcome.
I'm going to be palpating your abdomen today and palpating for an enlarged liver. Do I have your permission to present?
Please.
Great. So firstly, are you comfortable?
Yes.
And do you have any areas of tenderness or pain on your abdomen?
No.
Okay. So I'm going to start in the right iliac fossa. And I'm going to ask that you please breathe in and out normally. Okay. I'm going to go along the ascending colon to your hepatic flexure, across your transverse colon, to your splenic flexure, down your descending colon, across your sigmoid colon, to your suprapubic region, around your periumbilical region, and up towards your iliac region. Okay. I can also perform a deep palpation where I apply more pressure and may even use 2 hands if necessary. And during palpation, I'm basically looking for any changes in temperature, any enlarged masses or enlarged organs or abnormal pulsations on the abdomen. Everything appears normal, so that's great.
Okay.
I can also look for any areas of rebound tenderness, especially in your area of the appendix. This is when I apply pressure and you don't feel any pain, but on the release of pressure you will experience pain. Okay. I can also look for guarding, where you enter your abdominal muscles, and in the instance of this, I can ask you to bend your knees for me, and then it's easier for me to palpate.
Oh, I see.
Awesome. Okay, now I'm going to palpate for the large liver.
Okay.
In most adults, the liver age is not possible, but in patients who are extremely thin and patients who have an enlarged liver or hepatomegaly, one may feel the liver age a few centimeters below the right nostril margin. So I'm going to start by first finding a metacardial line. Start here. I'm going to place my fingers on the metacardial line, lateral to the rectus abdominis muscle, and parallel to the right nostril margin. Okay, I'm going to ask that you please breathe in and out deeply through your mouth, and on inspiration I'm going to keep my hand still, feeling for the liver age to strike it, and on expiration I'm just going to move it a few centimeters up. That's good. Out, in, out, in, in. Okay. So your liver age is not palpable, but in the instance that I could feel it, the liver age should be firm, smooth, non-tender, and hard. But as I said, I can feel the liver age. Thank you.
Goedemiddag, Mr. Van den Nijvel. I'm sorry, I'm a student doctor here, and I was asked to cast your abdomen and your liver for an abnormalities. Is that okay with you? So I'm just going to listen to the sounds, and I'm going to start in the right iliac fossa, resonance, ascending colon, resonance, hepatic flexure, resonance, transverse colon, resonance, splenic flexure, resonance, descending colon, resonance, sigmoid colon, resonance, suprapubic region, also resonance, then periumbilical region, or resonance, and then last pubic acid region, nice and resonant. So I don't see anything abnormal there. Then for your liver, I'm going to start also in the right iliac fossa. I'm going to move upwards from the metacardial line. Resonance, 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 down. So this is where the liver age is. So I'm going to move up also in the metacardial line. Find your angle clearly on the second intercostal space. Resonance, 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 down. So I can see your liver is right here, which is less than 12.5 centimeters, and that's perfectly fine. Thank you so much.
Thank you.
Going to examine your spleen. So your spleen is located underneath, behind your stomach, so it's roughly about here. How I'm going to do is I'm going to ask you to breathe deeply in and out of your mouth, as I palpate from your right iliac fossa towards your left hypochondria. Okay, so can you breathe in for me and out? Okay, so I can feel no palpable masses, so that indicates that your spleen is not enlarged. If I were able to feel your spleen would have to be 3 times its normal size. I can rotate you to the other side if I can't, so you have to shift towards me, and then I would repeat the examination from your right iliac fossa to your left hypochondria. Thank you.
Thank you. I'm here to perform a routine auscultation on you today. Do I have your permission to proceed?
Please.
Okay. So I will begin by listening to your vowel sounds in your 4 upper quadrants with the diaphragm of my stethoscope, and I'll begin in your right lower quadrant. Moving to your right upper quadrant, your left upper quadrant, and then moving to your left lower quadrant. I will also then listen in your epigastric area for possible breweries. So from what I've heard, everything sounds fine. You have normal gurgling vowel sounds, which is the norm. I can hear normal peristalsis every 5 to 10 seconds. If you had absent vowel sounds, I would have suspected paralytic ileus, but everything seems to be fine. And there was no wave washing sounds coming through to my stethoscope in the epigastric area, so I do not suspect any breweries coming from your abdomen. If you would mind just getting up, I think you are all right to be discharged. You may just get dressed.
Okay, so Mr. Panamabra, I see in your file that all ratings were good. There's no abnormalities, nothing at all. So this was just a checkup for you.
No, I was just looking for the bathroom.
Okay, then that's just right across the hall, sir.
Oh, okay, thank you.
Nobody wakes up thinking, my world will explode today.